Good morning, everybody. Oh, those are pretty loud. And welcome to the Workforce, Labor, Economic Development, and Finance. If somebody can turn the volume down just a bit. I am a louder person. Where do we do that? Anyway, one of our pages able to do that? So, good morning again. Welcome. It's February 24th. We've got a fairly simple agenda today. We're going to just give an overview of the paid family medical leave program that has just recently rolled out. So we'll take a peek at that. I'm sure members will have a number of questions. So I appreciate Deed being here. If they want to actually move to the testifying table, that'd be fine. We do now have a quorum, so I would entertain if Chair Pinto would want to move the minutes that were in your packet.
So moved, Mr. Chair.
Thank you, Chair Pinto. Any further discussion about the minutes? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? Those minutes are passed from, the date is, let me check on that, the 19th, February 19th, 2026. Thank you very much. Again, welcome to the committee, Director and Commissioner, and we appreciate having you here today. In the workforce, of course, we've been talking a lot in the last several years about paid family medical leave and how it's going to roll out, how it now has rolled out. I want to congratulate you for at least not making it a min-large disaster at this point, and we appreciate that. We really, really do. And I want to give you credit where credit is due. I know we spent a lot of money on this rollout, but I want to say when at least it's gotten out where families and folks can start to at least not feel like they're not being heard and answered. So again, I appreciate that very much. So today is just giving us an overview. I know it's early. Again, we're still kind of chomping at the bit to understand it better. There's still a lot of people and businesses out there that don't know as much about this as they should, but it starts with conversations like this. So, Commissioner, Deputy Commissioner, welcome. Please introduce yourself for the record and proceed.
Well, thank you very much, Mr. Chair. My name is Evan Rowe, Deputy Commissioner at the Department of Employment and Economic Development. I am joined by Paid Leave Program Director Greg Norfleet. The way that we will do this is I will take the first chunk of the presentation, and Director Norfleet will take the latter half, and then we'll welcome your questions. If it's all right, Mr. Chair, if we can hold questions to the end.
Sure.
Just for simplicity's sake.
No problem.
We'll do it that way. Simple agenda for the committee today, simple agenda on our slide deck today. We have some background on the paid leave law. We have a brief, just a brief touch point on public engagement, and then we'll get into some of the program implementation details, and I believe you all have the presentation in your packet already. But we wanted to start just to ground the committee with some background on the paid leave law. It's always helpful, I think, to have these conversations rooted in just the fundamentals of the law itself. So the paid leave law was enacted in 2023 and began January 1st of 2026. The law provides job protections and payments from the state to individuals who need time off to care for themselves or for their loved ones. Paid leave is funded by premiums that are made up of contributions from employers and employees. And paid leave sends benefit payments directly to Minnesotans on leave. What does paid leave mean for Minnesota? Well, it's worth remembering Minnesota is one of 13 states plus the District of Columbia to enact a state-based paid leave program. But the United States is an outlier, right? Only 7 countries worldwide do not have some sort of national paid leave program. And the United States is the only highly, one that would be highly developed under the UN standards. Additionally, the U.S. Bureau of Labor Statistics noted back in 2023 that 73% of American workers lack access to a paid family leave program. And what states have implemented paid leave programs have seen include stronger employee retention, better health and development outcomes for children, higher labor market attachment for women and labor force participation. Generally, it makes it easier, particularly for women, but for all Americans or applicants to stay in the workforce, and it leads to greater economic security for families overall. Coverage under Minnesota's paid leave law is broad. It covers nearly every Minnesota worker. I won't read all the covered workers since there are, since I think we have about 11 categories there. Faster to discuss who isn't covered. Not covered but can opt in include independent contractors, self-employed individuals, and tribal nations. And then folks that do not have the choice to opt into the program include federal government employees, railroad workers, and then designated seasonal employees. There are 2 broad lines of coverage under Minnesota's paid leave law. There's medical leave and there's family leave. I'll take each in turn. Medical leave is leave to care for an individual's own serious health condition. There are a few different sublines of family leave. Bonding leave is leave to bond with an individual's child within 12 months of the birth, placement, or adoption of that child. Military family leave is leave because a family member has been called to active duty or notified of an impending call to active duty to the armed forces. Caring leave is to care for a family member with a serious health condition. And then safety leave is leave because of a situation of domestic abuse, sexual assault, or stalking of an individual or the individual's family member. Within each of the broad buckets of coverage, medical leave and family leave, there is a maximum of 12 weeks for any one line. If an individual has a circumstance where they need to take both types, both medical and family leave, they have a combined maximum of the program of up to 20 weeks in 1 year if they qualify for both. All qualifying conditions must last at least 7 days, and they must be certified by a qualified healthcare or other appropriate service provider. That would be generally in the case of military family or safety leave. It's a different certifier than a medical doctor. In terms of payments under the paid leave law, Minnesotans get partial wage replacement under paid leave. You do not get 100% wage replacement under the law. Lower wage workers get more support. If you earn less, you get a higher percentage of your paycheck covered while you are on leave. The maximum weekly benefit is $1,423 per week. That's tied to the statewide average annual wage. To be eligible for any benefits under the law, you must have earned at least 5.3% of the statewide average annual wage in the past year. This year, that's about $3,900. And payments from unemployment insurance, workers' comp, or SSDI will lead to either an offset or a denial of paid leave benefits, depending on the specific nature of the circumstance. In 2026, the premium rate for paid leave is 0.88% of wages for large employers and 0.66% for small employers. We'll get back to that difference in just a moment. That covers both the family and medical leave lines of coverage. The premium rate is applied on wages up to the Social Security cap. That's $185,000. First premiums this year are going to be due on April 30th, 2026. Employers have already been submitting wage detail over the past year to provide the department with information, but the first premiums under the program are not due until April 30th. That's because of the appropriation made by the 2023 legislature to pre-fund the program. Generally, premiums are shared between employers and employees. That is to say, employers may deduct up to 0.44% of the premium from employees' paychecks. They are not required to do so. They can choose to cover more, but I think the majority of employers choose to share it with their employees. Now, as I mentioned, small employers pay a reduced premium. For small employers, rather than 0.88, their effective premium rate is 0.66%. They can still choose to charge their employees 0.44% under the law, so the small employers can take that 0.22% as savings. To qualify, an employer must have 30 or fewer employees, and they must have an average employee wage of 150% or less of the statewide average wage. So on average, they must pay their employees less than about $107,000 this year. That's a standard that'll change with inflation over time. Another support for small employers under the paid leave law are small employer assistance grants. Employers can apply for these small employer assistance grants once an employee is approved for leave. They're funded. This was funded by the paid leave law at $5 million per calendar year. Again, for qualifications, they must be a small employer using the same criteria I mentioned on the previous slide, 30 or fewer employees, and they cannot have a high average wage. And then they also have to incur the costs already. This is done on a reimbursement basis. It's not done on a prospective basis. That's, I think, for reasons of program integrity. Benefits, the max, per leave, an employer can receive up to $3,000 per leave, or a combined maximum in a calendar year of $6,000 per employer. And they can use these to defray costs tied to a leave. That could include hiring a temporary worker, increasing an existing worker's pay, or conducting cross-training to help existing staff be able to take on different job responsibilities. Employment protections under the paid leave law. The program has protections for workers that make it possible to actually take this leave. These protections include job protection. Generally, you have to be restored to your job or an equivalent position when you return from leave. Generally, health insurance and other group insurance must continue with the split of health insurance costs being maintained at the pre-leave level. And employers are prohibited from retaliating or interfering with an individual's good faith application and use of paid leave. These protections apply no matter how long you've been at the job. These provisions are enforced by the Department of Labor and Industry, but they are a part of Minnesota's paid leave law. And then equivalent plans. So employers can choose to meet their responsibilities under the paid leave law by providing employees an equivalent plan that either meets or exceeds the coverage provided or offered by the state. They can be purchased from a private insurance carrier, or employers can choose to self-insure and provide coverage to employees themselves. Employers still have to submit wage detail reports and comply with requirements to notify employees about coverage. And then we've worked with the Department of Commerce to certify equivalent plans, and I think there are at least a couple dozen that are available, and many employers have chosen that option. An equivalent plan can cover family leave, medical leave, or both. Then just wanted to briefly touch on the public engagement that this team has done. I think probably I might even venture to say a majority of you have attended a paid leave public engagement session. The team has been all around the state, really working hard to get the word out about the program, answer questions in advance of the launch, and really use this as a way both to share information about the program, but also learn. And I think Director Norfleet can speak to some of the ways in which these public engagement sessions have been tremendously valuable to the program in terms of providing insights from employers, from applicants, and from members of the public who are generally interested in the program. Over 300 engagement activities since November of 2023, over 40,000 individual connections made. The majority of those have been with employers at employer-focused events. I would say, again, it is a big change for Minnesotans, but generally speaking, got decent feedback from employers about these sessions being valuable in terms of their increased education and knowledge about the law. And we really did try to have a blend, Greater Minnesota and Metro, online and in person, so that folks can do what works best for them. And we have a bunch of these sessions that have been archived online that still, I think, have very valuable content for Minnesota applicants, employers, and the whole community. So with that, Mr. Chair, I will turn it over to Program Director Greg Norfleet to provide an update on program implementation.
Thank you, Mr. Evan. And again, welcome, Director. Please introduce yourself for the record and proceed.
Thank you, Chair Baker. For the record, my name is Greg Norfleet, and I serve as the Director for the Paid Leave Program here in Minnesota. Just 2 years ago, I was the first full-time employee of the Paid Leave Division, and under a tight timeline, we were tasked with launching a statewide program to support Minnesotans in some of the most important moments of their life, from the birth of a child to saying goodbye to a loved one. These moments matter, and it's our goal as the division to ensure that you, as a Minnesotan, can be there when it matters. I've had the privilege of serving in the role of director, and I'm grateful to be able to lead an incredible team of public servants that are truly committed to this work. Today, I'm going to walk you through some of the highlights of the past 2 years as we've built paid leave for the state of Minnesota. Let's start here. Even though we had a tight timeline, we still managed to launch ahead of schedule. Based off of experiences in other states, we knew that new parents would make up a large proportion of our initial applications at launch. This is lovingly called the baby bump in other states, where parents who welcomed a child into their home in 2025 are eligible to take leave starting on January 1st. Our initial launch took place in early November, where we welcomed applications from a small group of large employers across the state that were willing to partner with us. As the applications came in, we had the opportunity to work directly with these employers to understand how our system was performing in the real world and to identify areas where we could improve before opening the doors further. The success of that first launch allowed us to open up applications for new parents across the state early as well, starting in early December. Through the months of November and December, we were able to take in over 7,000 applications from parents across the state. This provided a unique opportunity to stress test our systems, processes, and our team as we prepared for the full launch of the program, which occurred on December 29th, also ahead of schedule. This next slide really tries to explain how we got here and the difference between the way that we work and how a lot of large project management projects work. So this slide reflects how we work as a division. We're relentlessly incremental and try to apply lessons that we learn along the way. When you think of how project management can work in a lot of large projects like paid leave, you think of it in terms of a waterfall or different phases of development, where you could start with building requirements. You could build requirements for 6 months, even a year, before you ever start coding or building anything. From there, you would send it over to designers to figure out how you want to implement against those requirements. You'd bring in engineers to actually build the technology. You would try to integrate it into the rest of how the state works or how the rest of your system works. You would test it thoroughly. Your testing, again, could be 3 months, 6 months, as you're testing every single use case. Then you deploy, and you go live with a big bang deliverable. The big problem with this way of working is that at the end of that process is the first time that you ever really check to see if you built the right thing, if you're building what your end user needs. So instead, unlike traditional project management, the way that we work is small, and we start small and we iterate frequently. So we take all the components, one piece at a time, looking at opportunities to build small but end-to-end experiences in order to test and build upon success. So when you start this way, you can build something small, and then you can test and ask your end users whether or not this solves the problem that you're actually trying to solve way, way earlier in the process than you would in a traditional project management framework. Then you can iterate upon that feedback. In this case, the story that this slide's trying to show is we thought that you wanted a blue star, but after doing some testing, we found out that actually you wanted a pentagon, not a pentagram. From there, it wasn't that it was blue. You wanted something that was yellow. And from there, we did some more testing. We knew we were on the right track, so we continued to scale up. That approach allows you to get feedback from users throughout the development cycle, which makes it so that you can be agile and be able to respond to the needs of your actual users. One example of how we did this was in last session, we demonstrated a recorded end-to-end demo of a bonding leave application. That demo was an initial building block for the remainder of the applicant experience. We used that demo throughout implementation because it encouraged real, concrete, and tactical feedback from our users to help us build a solution that was directly responsive to their needs. Okay. This isn't just a good way of delivering software, it's more cost effective. We came in significantly under budget, about $70 million below anticipated costs. These savings will revert directly back to the Family and Medical Benefits Trust Fund, meaning that those benefits go directly towards Minnesotans during those major moments of their lives. Responding to change is an organizational muscle that the division has built over time. One really good example of this muscle in action relates to how we were able to adjust to changing IRS guidance. The IRS issued guidance for state-run paid leave programs around this time last year, which would require a portion of medical leave benefits to be treated as income subject to federal taxes, including Medicaid and Social Security. We worked with payroll providers, insurers, and business owners across the state to develop functionality within the employer portal to support compliance with the federal guidelines, which was ready to go in advance of our launch. But we got a surprise. On December 19th, the IRS issued updated guidance. That updated guidance delayed the implementation of treating those medical benefits as taxable income by a year. Our team was able to implement a solution within 10 days and prevent overwithholding from applicants and employers. Assuming that the IRS maintains their previous guidance for 2027, we will be prepared to implement that guidance on time with limited costs. Our approach leads to high-quality, secure, and responsive experiences for Minnesotans, regardless of if they are applicants, employers, or healthcare providers. We have received positive feedback through our early launch, but we also remain committed to building on our strong start. We also do receive challenging feedback at times. We know that we're not perfect, and we use this feedback as helping us identify opportunities to continuously improve our service offerings. We meet with employers, healthcare providers, and individual applicants on a continuous basis to understand their experiences and to identify ways to improve. One example is that we launched a fully featured employer portal that provides employers with actionable, transparent information when their employee applies for leave. This was initially presented as a paginated list within the portal. So if you had, say, 30 employees that were applying for leave, it would be in a single list that would be 10 on each page that you would be able to see. After we launched, we heard feedback specifically from large employers that they needed the ability to search for individual applications. We took that feedback seriously, and we have since launched a search function. We're also building on this success to allow employers to sort and filter applications in the near future as well. On this slide is a post that we got in social media from someone who really appreciated the inclusion of employer search. I just do want to note on this slide that we are continuing to improve upon our service offerings across the program and that we release improvements every week. We do all of this while balancing user experience with a commitment to program integrity. Our program integrity approach includes controls over our people, process, and technology. As the Deputy Commissioner previously testified, our approach to program integrity does not rely on silver bullets. Instead, we have a series of overlapping controls that leverages information from employees, employers, healthcare providers, and our own administrative data to review each and every application to ensure that our limited funds go towards their intended use. We leverage some pretty cool technology here, including login amend to support identity verification with potential applicants. And we've also begun an exciting pilot in partnership with Fairview Health to support an innovative and secure way for healthcare providers to certify their patients' need for leave that builds upon how our partners already work today. 3.5 months into the program, we've received just over 47,000 unique applications and have made over 30,000 determinations, 2/3 of which have been approvals for leave. Out of the gate, the majority of approvals were for bonding leave. But since January, we've seen an uptick in medical leave applications. Combined, these two types of leave account for nearly 90% of our applications. Taking leave to care for a family member represents just over 10% of our claims volume. Of those caring leave claims, 34% are for folks that are taking care of their parent or a legal guardian. 29% are for folks that are taking care of their spouse or a domestic partner. 29% are for claimants that are taking care of a child. 3% for a sibling. 3% for either a grandparent, a grandchild, or a son or daughter-in-law. And then 2% that don't fit in any of those categories but have a reasonable expectation for care without compensation. Some additional facts on our claims to date. Most leaves are lasting less than the maximum duration of 12 weeks, with an average claim being just under 8 weeks in length. Bonding leaves are averaging 8.7 weeks, medical 6.6, and caring 5.9. The majority of leaves, 88%, are for a single continuous block of time. The remaining 12% are either taken intermittently or on a reduced leave schedule. 62% of our applicants are under the age of 40, 69% are women, and 67% work for an employer of 200 or more people. Our current average weekly payment is $1,121, which is 78% of the maximum benefit. We can say today that the pattern of applications that we're receiving mirrors the experiences in other states, with demand peaking out of the gate. The decision to launch early allowed us to take in over 7,000 applications before January 1st, and we saw peak demand on January 2nd with over 2,000 applications submitted on a single day. Since that first week of January, we have seen a week-over-week decrease in claims volume of between 6 to 10% each week. The early drivers of demand for our program include predictable structural changes, such as 2025 children, or transitioning an employer's ongoing FMLA caseload onto the paid leave program, as well as a number of factors that have increased the awareness of the program, including point of service referrals from healthcare providers. We are required, with all of this information, we are required to work with a qualified actuary each year to assess the premium rate, which will include an analysis of the actual claims that we've received, as well as the balance in the benefits trust fund, which will include that $70 million reversion at the end of the year. That report from the actuary is due by July 1st of this year. With that, we want to thank you for the opportunity to present on the program today, and we are prepared to answer whatever questions you may have.
Thank you, testifiers, for the overview. I just want to welcome members to let our committee legislative assistant know if you have any questions. Again, we'll have plenty of time for questions. I don't want anybody feeling like they're rushed today. This is our only really item of discussion today, so we appreciate the time to be able to kind of dive in and kind of this early questioning. So I've got a few questions up on the front here, and then again, I know I will welcome other questions as well. As you stated earlier, and maybe this is to the director, either one doesn't matter, the employer engagements were really critical for you around the state ahead of time, and I did attend several of them. You had made a comment about how important that was for you to help develop and kind of, you know, I can't say change it because you had to work within the confines of the law. But what was the one or two things you maybe took away from those conversations from employers that are extremely uneasy about this new offering? What did you take away from that, and how did you kind of bake in maybe some easements for them to kind of maybe be a little bit more open to the program? If you could share a couple of your thoughts on those engagements.
Yeah, thank you, Chair. Yeah, our engagement sessions were extremely valuable across the state. I think the major thing that we learned is that employers really needed actionable and transparent information about individuals who were requesting leave and visibility while they're out. That led directly to the development of the employer portal. So our leave administrator portal is the most fully featured portal that's launched in a paid leave program to date. It includes information about who's applied for leave, what the decision has been made on those leaves, as well as information about our small employer assistance grants, and really kind of giving them a one-stop shop for being able to interact with the program. It's been extraordinarily, it continues to be extraordinarily important for us to talk with employers across the state. Employer Search is a good example of stuff that we've been able to launch since going live, but those engagements are continuing today, and we are looking for opportunities to improve across the entire system.
Okay. Thank you. $70 million is coming back into the program, which is good to hear. What was the cost of actually setting it up? I don't remember, was it $688 million to start the whole program? And then, again, just maybe break it down a little bit. So what did it actually cost to build it to this point?
Thank you, Mr. Chair. I'll start on this one. So there's maybe two different buckets of funding. The number you quote was the total appropriation, but the vast majority of that was programmed for the first months of benefits under the law. Essentially, there were the first operational appropriations that basically meant to support the department in terms of implementation from the beginning of fiscal 24 through December 31. I think total appropriations there were $160 million. So it's $70 million off of that is where we're at.
Okay. And typically, is it still, give or take, and maybe you've got a number on this, what is it in our estimates that this program will generate in premiums each year? Is it about $1.5, $1.6 billion?
From memory, Mr. Chair, I think it's about 1.3 overall. But I can follow up on the exact number. And again, we'll as we get wage detail returns in, we will know with 100%.
I just want to, as I use that number too, I want to make sure we're operating off the same sheet there, because I've used that numbers like that before. And again, finally, there's other questions coming in, and we've got more time to work on this during the session. As the major milestone of getting it out launched now, what is the next step for hearing from employers, maybe, is there plans of this summer, this fall, to continue to listen to real stories out there of either positive, spins or concerns? Are we tracking vacancies? My biggest concern is, how does this affect the worker vacancy rates out there, larger than maybe there already was? Are we tracking some of those things? And then what is the future for the engagement for employers later this year, if any?
I might have Director Norfleet just start on the employer engagement, because I'll just say that is not something that stops for us, right? Our intention in this program is to be relentless in terms of continuing to improve the program overall. And I know that there's, I think, some really good stuff in the hopper that Director Norfleet could probably speak to.
Yep,
Director.
Thank you, Chair. We're not waiting until the summer. We're meeting with employers today. So with everything that we're building, and we're taking feedback from a variety of sources, large employers, small employers. If somebody reaches out and has direct feedback with the division, we try to set up time to do user experience testing with them to identify how the process is working, if there are ways that we might be able to improve it for them. That is a continuous discovery process, and we do encourage employers to reach out to us if there are areas that they see that could be better or things that could make the experience more smooth.
And to your question just around, research agenda, making, understanding impacts of the program, the division does have, has built, built systems in a way to try to be able to conduct meaningful research over time. It's still obviously early days. So I think, that's the kind of thing that we'll be able to do, that we'll be looking forward to do in the, certainly in the months ahead. We certainly want, we know that this is going to be a transformative program for Minnesotans. We're eager to understand the impacts on Minnesotans across the whole spectrum in terms of what it means for employers, what it means for, for applicants, what it means across the board. So I think as we get more data, as we have as we kind of have a more fulsome set of things that we can work with, we're really looking forward to looking into this and seeing what it means for Minnesotans.
One further question. I think I said I was done, but I'm not quite there. But one of the concerns that I have as an employer from other employers who've received determinations from employees taking time off, this program has been sold on a partial payment. We are seeing people getting actually full payment, up to 95 to 100%, on ways of how it's being calculated. And I think it's being used on your highest quarter of salary or income over a last 4 periods. But I've seen many determinations and that are showing where a person might be making 60, 70,000 a year on average. I would say would roughly fall in that 67% range, maybe in the scope of what we wanted to give partial payment to, but yet they're in that 95% range. I've seen a couple of them like that. Again, they're not doing anything wrong. It's just, is it calculated that way? Are we seeing some of those examples? And I think that's important to set the stage for. That would obviously deplete the funds more if that were the case on a high level, but also it's going to keep workers out of work longer because there's not an incentive to come back to work, if you know what I mean. What are your thoughts about any early indications about what I've just mentioned?
Well, thanks for the question, Mr. Chair. And I think the rationale originally for the high quarter calculation is, I think is you do have some people who have very cyclical pay, and you would not want them to be unnecessarily disadvantaged by such a program as well, right? So I think that's my sense is that was the policy intention behind it. I don't think that we're seeing any, I can't say that we don't really have the visibility to do a deep analysis on the trend there, just because we don't have we don't know all those pieces. That's something that we could certainly look into over time. I wouldn't say that the overall trend, just in terms of the average weekly benefits that we're seeing, it's actually pretty much right in line with where the actuarial study would have projected that $1,121 a week that we're seeing on average. So I'd say from a systemic standpoint, we don't see a skewing higher than we would necessarily expect to see. But I appreciate the question. It's a policy design choice, and it's certainly one that can be discussed.
To member questions, Representative Bakeberg.
Thank you, Mr. Chair. Thank you guys for being here today. Nice job on the presentation. I want to kind of jump off of what Chair Baker talked about with the engagement. I really appreciate the time and the spread of engagement that you guys did. 40,000 individual connections, 330 different engagement activities, metro, rural, virtual, in person. So thank you for that. And I appreciate that you're continuing to have those engagement pieces, because if I'm going to be frank, this is the #1 engagement feedback piece that I've gotten from constituents since we left last year. So my question is, so you talked about, based off of that feedback, some tweaks that you've made to the system, which is great, and I appreciated how you talked about just that agile delivery model. But can you be specific about, based off of the feedback and the ongoing feedback, do you have any legislative changes for us that DEED is recommending in order to make this program serve Minnesotans better?
Mr. Commissioner, Deputy Commissioner.
Thank you, Mr. Chair, and thank you, Representative Baker. Really appreciate that. I think, at this time, we don't have the administration doesn't have a proposed policy bill for the law. Certainly, I know that this bill, that this law is going to be has been, and I'm sure will continue to be the subject of debate. And we'd certainly, if we're, as a department, we're very happy to provide technical assistance if members are interested in making changes. That's something that we're very happy to do. We do believe the law is administrable as it currently stands. We're running it, and it's working. With that being said, totally understand that members may have thoughts about ways they might like to tweak it, and we'll certainly, you can expect the department will engage constructively in any conversation in that regard. But no, at this time we don't have any plans for recommendations at this point.
Rep. Bakeberg.
Thank you, Chair Baker. So out of all of the feedback, the 40,000 individual connections, the 330 engagement activities, the decision has been made to not make any changes, tweaks, as minor as they could be, to paid family medical leave. And I've got another question, but I just want to make sure that I'm understanding your response correctly, that there are no changes coming forward, as minor as they can be.
Commissioner.
Mr. Chair, Representative, I guess what I would say is, the program launched on January 1st, right? And I think from our standpoint, our focus of engagement has been implementing the law as it currently is, right? And staying really focused on delivering an excellent experience to all stakeholders in the state. We certainly expect that there will be conversations, and again, we stand ready to engage constructively in those conversations. But our focus is on implementing and engaging to make sure that the program as designed is running smoothly. But again, we will be very happy to engage constructively in any subsequent conversations.
Representative Bakeberg.
Thank you, Mr. Chair. So one of the main pieces of feedback that I received from my constituents, we could go into seasonal workers, we could go into the age of workers, we could go into all kinds of things. But one of the common pieces that I heard was an aha moment that this applied to their business. There was an assumption from many people that, well, Ben, I've only got 30 employees, or I've only got 1 employee or 2 employees, so this doesn't apply to me. And then the realization for them, while we appreciate, or they appreciated, the 0.66 versus 0.88, can you guys clarify, is the administrative oversight or administrative burden, the mandate for reporting, for tracking, for job holding, which is a big deal, is it any different for our employers under 30 versus over 30?
Commissioner.
Thank you, Mr. Chair. Representative, I would say that the law treats employers the same in that regard, just in the sense that for an individual who is applying for paid leave, we need to have the correct information to be able to adjudicate a claim correctly, no matter who the employer is. I will say, one thing we didn't mention in the presentation, we have tried hard to leverage existing systems, such as the unemployment insurance system for wage detail and premium reporting, to keep any incremental compliance needs to a minimum. I'm not saying there is no incremental requirement there, because it is a significant program, and it requires, we do need that information from employers so that we know how to correctly calculate a weekly benefit under the program, how we can provide information back to the small employer to make sure that they have the information they need to know information about the leave that's been requested. And again, I think you heard Director Norfleet kind of speak to our commitment to continue to make this easier, smoother, better as we go along. I'd also note that there is a modest grant program under the law to do outreach to various kind of groups to help them leverage the paid leave program appropriately. And there are several of the grants that we have made focus on technical assistance for small businesses specifically, to kind of help them with some of those pieces.
Representative Bigberg, follow up?
Yeah, just for the sake of time, I'll take my grant questions offline with you. But I just want to share an email, and I had a conversation with this employer as well. So I just got this, and this is one of my constituents. So I would offer you feedback from this constituent. So I'm just going to read it so I have it correctly. I'm a small business owner. This has been a very, very difficult year since paid leave became effective January 1st. One employee has taken off 8 weeks since he had a baby in July of 25. He's also scheduled to take an additional 4 weeks off prior to July 1st of 2026. This employee is our one and only operator that can do the specific job that this employee does. We have lost significant amount of work because we have no other operator to operate our equipment. Plus, how can I hire anyone knowing that they will only be a short-term hire? I have not been able to find anyone with that type of experience to hire. So 2 main problems there. So until he returns back to work at the end of March, my business will continue to lose money. Since I have the overhead, even though I am unable to bill anything out. She goes on to say her concern is that this paid leave law will be the nail in the coffin for her business. And I can assume that the employee that's out may not have a job to come back to. That's the bigger concern. So where I appreciate the public engagement, I would highly encourage all of us to take feedback and then change things based off of the feedback from our community. Because if we don't change and take feedback and change laws, it's not feedback, it's just a listening session. And it's more of a dog and pony show than it is solving problems for our community. Thank you.
Thank you. Representative Schultz.
Thank you, Mr. Chair, and both to Director Northley and Deputy Commissioner Rowe. This is a very hearty presentation, and I look forward to digging into it in detail, and I hope that Minnesotans do too. Frankly, I'm glad that we have the whole hearing for this, Mr. Chair, because it's just a lot to digest in general, and then apply our own experiences and the feedback that we've gotten from Minnesotans so far this year.
And just to interrupt 1 second too, Representative Schultz, this is the first just overview stuff. We're going to have more discussions around paid family, later this session, how it's affecting some people, some businesses and some groups. So just I want to make sure we will be talking about this again, and I just want to put that out there to the public. Thank you.
Great, thank you, Mr. Chair. So to our 2 folks from DEED here today, I'm going to primarily focus, I've got several questions in relationship to program integrity and fraud. And so to begin on those questions, I'm just curious from the very get-go, what are the most common reasons for someone to have their application rejected so far? And I especially mention that because, and I know the data is a little bit different today than what we heard just like 2 weeks ago. I believe it was the commissioner who had said that almost 2/3 of applications had been rejected. And so super curious as to what the most common reasons are for applications to be rejected.
Director Norfleet?
Thank you, Chair Baker. Thank you, Rep. Schultz. The two most common reasons for a denial are that the individual has applied against the state plan when they're covered by a private plan, and they've failed to provide the certification necessary for the particular type of leave that they're asking for.
Director Norfleet, could you pull that microphone in a little closer next
Sorry,
time? Thank you.
is that better?
Is that what you, yeah.
If
thank
you
you.
could repeat,
That's
yeah,
better.
it is better. If you could just repeat that very last section,
Last
like
one,
last paragraph.
Lack of certification documentation. So we require you to provide a form from your doctor that's either like FMLA paperwork, our own paperwork, or based off of what's required for that particular type of leave. If that's filled out incomplete or it doesn't show that you need the leave for the timeline that you've requested, then that would result in a denial as well. And that's the other most common.
Representative Schultz.
Thank you, Mr. Chair. Just following directly off of your feedback right there, my question is, are you anticipating that that same applicant is going to come back after having filled out that information and so, in essence, at a later time, be granted the leave, just based upon what you're seeing?
Director.
It's possible. In some cases, they do come back to reapply when they do have the necessary medical certification. In other times, there's a misunderstanding of what the program is for. So we do get requests, for instance, for we get letters that this person is under my care, but it doesn't have the timeline that they need to be out, nor does it certify a serious healthcare condition. It may be that they're asking for less than 7 days of leave, where our program, you have to be out for at least 7 days in order to qualify. So it does vary somewhat. If they are able to provide that, we do request information. So that is a process that we do. If you don't have certification, we ask you to provide it. If you're unable to provide it, then it will result in a denial. And then you can still appeal and provide that certification document at a later time as well.
Representative Schultz.
Thank you, Mr. Chair. And then with regard to overpayments, how many instances of overpayments has DEED had to deal with so far?
Whoever wants to take that one.
Say we might need to follow up on that. I don't know if you have that one handy. It's relatively small at this point, Mr. Chair, just because we're still in early days of the program. But that's something.
Yeah, we'll have to follow up with the exact numbers. The biggest reason for an overpayment to date is that someone ends their leave early or changes their dates and hasn't told us in time, and a payment might have been generated in that case.
Representative Schultz.
Thank you, Mr. Chair. There was a press conference in which DEED mentioned that some cases relationship to fraud had been referred to the Bureau of Criminal Apprehension. And so the quick question is, how many of those cases have there been to this point?
Commissioner?
So I guess I don't have the number right in front of me. I will say several. I know I'm not trying to be, trying to. It's a significant number, but I would say probably double digits. But that's not unexpected. We take that seriously. I also do want to be a little bit careful about getting too far on confidential information. But I think it's double digits.
Okay, Representative Schultz.
Thank you, Mr. Chair. And just a quick comment on that. This is my request to you that you maintain the list of those folks who are being referred to the BCA, and that to the extent at which possible under law, that your agency is communicating the people who have been referred to the BCA and communicating those to the extent able under law to the other state agencies so they are aware of this criminal activity. In addition, I just wanted to this is kind of a little bit of a broad question here. Looking at your program integrity standards, is there any kind of audit of the benefits as they're paid out, and more specifically, and this came from a Minnesotan to me this morning. Are you doing random checks of the claims that are made, so that we get a smattering of understanding as to if it's being used as intended?
Commissioner.
Mr. Chair, Representative, I guess maybe I could, just to make sure I can answer your question correctly. So I would say, there are multiple layers of review on each claim. Are you talking about, are you talking about going back and auditing an individual claim per se?
Representative Schultz, for clarity.
Yes, Mr. Chair, just as kind of the principle, like auditing helps us provide and government services better, right? And so just under your own statutory authority, you would have that authority to check in and ensure that the benefits are being used as intended, and to just be doing a random check of those claims to ensure that we are hitting the standards of the program as it was designed.
Commissioner.
Yeah, so
Deputy
we
Director.
do both. So on every claim that we review, we do include all the information we talked about earlier, but we also, at the time of payment, we do a random audit of applications that are due to be paid that day. So we review to make sure that that information is still accurate.
Representative Schultz, anything further? Okay. Representative Mecklin.
Thank you, Mr. Chair. I'm not sure which one of you answered this before. It's a follow-up to something that Chair Baker asked. As far as the annual revenue anticipated, you said it was about 1.3 billion, which is fine. I'm not looking for a specific number. What I am curious about is how much is that 1.3 solely to the state, or does that include the payments that are going to third-party vendors?
Deputy Commissioner.
Thank you, Mr. Chair. Thanks for the question, Meekland. So I believe the actuarial study was looking across the kind of across the entire program. It didn't make a specific allocation to private plan. It didn't assume a certain private plan percentage because it's different in because that number is different in every state. So presumably, but I would also say benefit payments would also presumably be reduced by a similar amount.
Representative Mecklin.
Thank you, Mr. Chair. So do you have a number based on that shows how much of the workforce population chose to go third-party vendor versus went to the state program?
We do,
Commissioner.
thank you, Mr. Chair. So we did, so in terms of the number of number of employers that chose to provide paid leave benefits through an equivalent plan, I think that was about just over 7,000 Minnesota employers. That's a relatively small percentage of overall employers in the state, but there are some reasonably large employers in that group. So I think it was about 19% of Minnesota workers are 19% of Minnesota workers are covered now by a private plan.
Vice Chair Mecklin.
Thank you, Mr. Chair. Okay, that answers that part of it. I have another, it kind of goes back to what Rep. Bakeberg was talking about. I had actually not my constituent, but in the South Metro, electrical outfit, electricians, and I've now heard this from 3 different electrical companies that they had a journeyman request to go on PFML effective the first of the year, second of the year, I believe. But you have to have a 2-to-1 ratio, 2 apprentices per 1 journeyman. So all 3 of them now have been forced to basically put an apprentice on unemployment because they didn't have enough journeymen to cover them. So now lies the problem where these apprentices, if this was to happen to them once every year where they had to take 12 weeks and go on unemployment, it would take them 5 years to get to their journeyman test rather than 4. But not only that, they're making much less money at no fault of their own. Has anybody thought of any kind of fix or workaround to not be putting these younger workers that are just starting out in these trade jobs in this position?
And to that question too, again, I know that those are maybe 2 different agencies. We're talking about some Department of Labor stuff, about how you're communicating with other agencies when examples just like that was brought up and being brought up. How is that being kind of worked through?
Well, thanks, Mr. Chair, and thank you for the question. I mean, I do know that, I think just candidly, I think there are probably differing views even within this committee on the nature of that problem, right? And the best ways to resolve it, right? I think there are I think you're raising a question of coverage. I think the challenge from a policy standpoint would be if one changes coverage standards, that could, that would also reduce coverage for many Minnesotans under the law. So I think this one is I think it is more of it's a policy debate here, which, is reasonable and valid for this committee and the legislature to look into. I would say in terms of administering the law, and administering the program, the department is here to administer the law.
Representative Mecklin.
Thank you, Mr. Chair. Well, I appreciate that. I mean, I have talked to people at the Department of Labor. We've thrown ideas back and around, and I think that we have a bill coming that we'll see if there's any interest in that. But that is on the other side. But we do, see these things that, you imagine if this apprentice all of a sudden something happened in their life, would they be eligible for paid family medical leave on unemployment in that period? There's a lot of things that people have asked, and I can't answer all these questions, but it's something that I wanted to bring to your attention because I've been hearing about it. I have another couple little questions here, but as far as functionality, when people are reaching out to you, do you have any data, like what's the average wait time when they call in? Do you happen to know that kind of number, like how long they're sitting on hold, or?
Deputy Commissioner, call center, feedback.
The Director Norfleet can correct me if I get any of this wrong, but I think last update, which was data through January 31st, I think we were averaging under 5-minute wait times on the phone. Some days are busier. We tend to be busier, for example, on the day after after like a Monday holiday, right? That's because folks come after the 3-day weekend. But I think it's it's something that we really want to provide good customer service to Minnesotans. I'd also say actually the phone system itself is actually kind of cool. It has the feature you can get a call back if that works better for your schedule. So,
Representative Mecklin.
And just one little quick part. I'm assuming that the call center is fully staffed?
Yes, it is.
Perfect.
Okay.
That's it. Thank you, Chair Baker.
Thank you. Representative Zalesnikar.
Thank you, Chair, and thank you, Commissioner, for the presentation. My questions, I have a few questions I'd like to ask that come from the district that I represent, northeastern Minnesota. And the first one relates to the J1 status. And it's my understanding from speaking to several employers that they use this status for a 4-month period, traditionally in high tourist season, summer, North Shore. And those employees have brought it to their attention that they don't pay Social Security tax, they don't pay Medicare tax. They're not ever going to use those benefits. So they're wondering why they're paying in to the paid leave.
Commissioner.
Mr. Chair, thank you, Representative Zalesnikar. I think the answer is they are not. That group is not. Is covered under the paid leave law, right? There is not an exclusion for that group under the paid leave law, so they are subject to the premiums. They would also be eligible for the benefits under the law. There's nothing that would make them ineligible for receiving paid leave benefits under that law. Now, I know there is. I think. Under the law, there is a separate seasonal hospitality exclusion, which you're probably aware of. It's a different provision, but it isn't tied specifically to J1 or other visa status. It's tied specifically to that industry.
Representative Zalesnikar.
Thank you, Chair, and thank you, Commissioner. I heard the answer, but I would recommend and suggest that you would reconsider that. These employees want to have the pay. They're not using this benefit. They've made it very clear. And they're vital to make sure we have tourism in the state. We spend a lot of money on tourism, and so I would suggest that it matches the other programs that we have. They're not. Then why are they not paying into Social Security, and why are they not paying into Medicare? The second question I have relates to the same feedback from employers asking the thought process on why 14-year-olds and dependents claimed on their parents are also eligible, because the payment cap is at $3,600. So you do straight math at $20 an hour, summer shifts, high school college students, that's about 23 days. If you're making $20 an hour, whether it's McDonald's or any other setting. The question is, what was the thought on that? Because it is a different situation than the other intentions that I understand for the program, and they're asking me this. It's creating a big issue for staffing for what they traditionally had in tourism season, which is a big priority also in Minnesota. So I'd like your feedback on that.
Commissioner.
Thank you, Mr. Chair. Thank you, Representative. I would say, again, it's tied to the coverage standard, right, and the wage test under the law. And I think the rationale for that would be, there are a variety of low-wage workers as well that potentially could benefit from the program, even if their wages are relatively low. Now, what I would note is if you only have about $3,900 in wages, your proportionate benefit under the program is going to be relatively small, right? I don't think it's a big financial risk for the program. But I think the question of exclusions is a question for policymakers.
Correct.
Again, I think we are administering the law as it is written. Happy to engage in constructive conversations, but we are administering the law as it is written.
Representative Zalesnikar.
Thank you, Chair, and thank you, Commissioner. And my issue isn't the dollar amount or the wage. My issue is the age. 14-year-olds, summer workers, those that are claimed as dependent on their parents. Dependent means dependent, and they're getting it's that. My third question is coming from counties. When I've spent time in my county, St. Louis County is the largest county in the state, and Lake County is very in greater Minnesota. But we have a requirement for people when they apply for medical assistance. So this is a question as to what the communication is between commissioners at the top agency level to ensure that when we pass mandates are in place requiring assessments to be in compliance with federal programs that are very clear in the MNsure program. So the county does these MNsure assessments for pregnant people, for various categories where they need medical assistance. There's a deadline of 15 days for that application, 45 days in another classification, 60 days for the population of typically elderly and disabled. Those have to be met on time to be federally compliant to get the 65% match. In counties that are small, which is greater Minnesota, you might have 2 people that are trained to do the MNsure, which is, a 20-hour online class, a test has to be passed, and then you have to have a criminal background check. If they're out, they will not be in compliance with the MNsure application. And once you start that application, you can only backdate 30 days or 3 months. So that window then, if it doesn't happen timely, means the hospitals won't get paid. Other people won't get paid, and they can't admit somebody. So the hospital's going to be stuck with people, and we've had that happen before, because they've depleted they have no payer source. They've depleted their private pay status, and then there's no place to put the person. So I'm very concerned about that, because in greater Minnesota, it's not Ramsey County, it's not Hennepin County where you have multiple people. Greater Minnesota has very few people in these programs, and you can't, by law, they're certified application counselors. You can't just have somebody do it. So I'm curious if the commissioners are talking through strategies for greater Minnesota because the county doesn't determine how many people will be out. The state program, the entire program could be, every employee they have that's certified could be out. So I'm curious as to the plan to make sure we're in compliance so clients aren't harmed by this.
Commissioner.
Thank you, Mr. Chair. And just to make sure I'm tracking the question, I think this is a concern about county workers taking paid leave. Just to clarify that. I mean, appreciate that point. It is, I think, particularly given the enforcement activity that we're seeing from the federal government that seems to be targeting the state. It is certainly a bigger issue than ever before. What I guess I would note is, I think many counties have, again, many counties have historically had reasonably generous leave policies, and so folks have been taking leave previously. I'm not saying this is not a change under the paid leave law. There are changes, certainly. But I do think that, this, especially oftentimes in the governmental context, it is different, but it is not necessarily totally different. With that being said, I'm in frequent contact with my colleagues over at Department of Children, Youth and Families, Department of Human Services. We naturally want to, again, work together. And do work together to, to make sure that our programs are working together as best as they possibly can.
Follow-up, Representative Lisnicar?
Thank you, Chair, and thank you. I think that it will be different because the benefits that have already been contractually agreed to are still in place too. And so the paid leave will be an additional thing. So the outcomes in greater Minnesota could be different on the numbers out. And it's very difficult to plan for this because they won't know necessarily either how many people are going to be out. But I believe it is a state's responsibility at commissioner levels to be communicating this. What is the plan? If there is nobody trained to do medical assistance applications across the state in pockets, what will be the backup plan? Because no backup plan is not a solution. And that's what I'm sharing with you, is that there always have been timelines for the last 30 years in healthcare that I saw. You had to do it. It's not just now. There's been federal mandates for this since the beginning of time. If you accept federal match, you have to have the requirements done timely. So my just concern is that there's a system of communication from the state agencies between DEED and the Department of Human Services and the Minnesota Department of Health, that when this is happening, that they're coming up with a backup plan to shared responsibilities or something with counties, because it will affect people. Thank you.
Representative Pete Johnson.
Thank you, Chair. First off, I just want to say congratulations on what appears to be a very successful rollout with the program. I know we heard a lot of questions and concerns last session about how that would look, if it was going to be a mess, what it would happen, and the fact that it rolled out as smooth as it did. And apparently under budget is an impressive feat, so thank you to you and all the folks that are working with you to do that. Some of the questions we've heard revolve around a lot around employers and their concerns and their difficulties with employees being gone or what to do in certain situations. There is a lot of unknowns and uncertainties when it comes to a lot of that stuff, and I do feel for those employers. But this is what workers have experienced for literally ever. Unknowns if they get hurt, unknowns if they have a kid, if they're going to be able to keep their jobs. Particular low-wage workers and women are ones that are faced with that, and we're seeing that in the numbers of the folks that are actually using this benefit to take care of loved ones, to take care of children, for that bonding time and everything else. So I think what we are seeing is growing pains from a system that was designed around workers choosing work over family, work over health, work over safety. And so there will be some growing pains with that. I have no doubt. With some of the metrics that you guys are following, obviously women are using this at over a 2-to-1 ratio than men. Are you tracking other things like the average wage of workers that are taking this? Is it typically lower wage workers that are using the benefit? Is it higher wage workers? Based on the average, it seems like it's probably somewhere in the middle, maybe towards the lower end of the scale. And then are you tracking any other metrics with this that we can use to show where and how to improve this program in the future? Things like the fact that we're in a childcare crisis right now, and people being able to take 12 weeks to bond with a child, keep them home instead of sending them to daycare, the dollars that are saved for families doing that, let alone the pressure that is on our current childcare system. So my question would be, is there anything beyond just those basics that you guys are tracking? Is that going to be part of a report that we'll eventually see, et cetera? Commissioner.
Thank you, Mr. Chair, and thank you, Rep. Johnson, for the question. Yeah, so the short answer to your question is yes. We provided a short summary of metrics, but We actually do, as part of the application, we have, we do have optional demographic questions that we ask all applicants, and so we are able to track that. We will have an annual report to the legislature, but even in the interim, we do have kind of some additional data. Just briefly, we didn't put it on the slide, but I'll note, I think, just in terms of racial ethnicity uptake, it is broadly representative of the state of Minnesota as a whole. You're not actually seeing you're not seeing, you're seeing demographics of applicants that look very, very similar to the state as a whole, which is good, because in the experience in other states, to your point, it has been in other states it has been easier for higher wage workers to take the program, and obviously there are correlations there, but what we would overall see is, so overall what I would say is we see an applicant pool that looks very much like the state of Minnesota, both in terms of racial ethnicity and income levels to date. That's a good thing. That's a sign that people are able to take the program across a broad spectrum of the population. Additionally, we, as I mentioned earlier, will certainly be, looking to do more detailed analyses to kind of see how the program interacts with employers, certainly, but also with things like childcare, with things like other economic outcomes as we go along. I think there's already some pretty robust literature if you look around the country, but we're certainly excited to see how those, if and how those general trends apply to Minnesota's specific context.
Any follow-up, Representative? And speaking of the metrics, and Representative Frazier, you're up next, so 1 second. You mentioned about the metrics, and I know that there's some other groups in the audience today that have been sort of looking for also other metrics. I'm wondering, is the department working with other NFIB, grocers, chamber, about what kind of feedback are they hearing? Because I know I've taken a survey recently, and I think we'll have it, get some feedback later on too, because to Representative Johnson's point, this is a major shock to the system. We've got to understand how this works in the smaller businesses, and there's a reason why it really hadn't been done before. Are you reaching out currently to other associations to get outside feedback as well? And I know there's somebody from the chamber here too, and I just want to maybe understand, I'm not looking for feedback or information, but if they could tell me if there is a survey, when will that be ready to maybe share? I'd like to have they come forward if they could, just for that quick moment, because I just want to say, are you also collaborating with other groups? So it's not putting anybody on that, but I'm just, help me understand that too.
I was going to say, I would say that, and the chamber can correct me if I'm wrong, but I would say that we've had very constructive and productive engagement with the chamber, with business partnership, with a variety of employer groups around the state. I can't speak to survey information necessarily, but perhaps Lauren.
Well, and thank you for that. And again, not to put you on the spot, Ms. Shortquist, but it's just if you could share you did a survey or doing a survey. I'm not sure if it's on. Just give us again, no information really. This is not that, but any information you have initially for that would be great.
Thank you, Mr. Chair, members of the committee. My name is Lauren Schotthorst. I'm the Director of Workplace Management and Workforce Development at the Minnesota Chamber of Commerce. And yes, you are correct. We currently have a survey in the field out to our membership on the user experience post-enactment. And the survey will close on Friday, so we'll have 2 months of data to reflect on. I hope you'll have me back before the committee to share those results, and we will certainly disseminate them to committee members as well once we have the chance to analyze them. We are seeking both quantitative and qualitative data, so some open-ended questions about the experience in their workplaces, the interactions with deeds, so we can work with the department on things that might not require legislative changes, and that's sort of what we're looking to do. One of our priorities this legislative session is to work on flexibility and operationality of this mandate now that it's live, and understanding what is legislative that policymakers can consider. We are, of course, well established on the record with some of those structural changes in the bill that you and Senator Frentz have to start, but building forward what other changes might be necessary this session from a legislative perspective. And then I've spoken with Deputy Commissioner Rowe on a number of occasions about sitting down after a session to run through the data. And to be clear, the department is working in real time with a number of employers, as you've heard today, on some of those real-time feedback changes that might be helpful for operational issues that arise. The dynamism between the system and employers is something that I think everyone's struggling with right now, and how to overcome some of those challenges is something that we're really trying to get our members to identify the most pressing issues, and then solutions or possible ways that we can work with the agency and policymakers. So that closes on Friday. I know that we have over 500 responses so far, so we have a really robust data set that's scientifically valid for you all to consider, and we'll share that results if you'll have me back.
Thank you very much. Appreciate that. Any follow-up on Commissioner? Otherwise, I'm going to go to Representative Frazier.
Good to know.
Yeah, thank you so much. Appreciate that. And again, I think we all as policymakers, we need as much information as we can to absorb this new mandate, and that I'm glad maybe your group and other groups are looking for that feedback. So thank you. Representative Frazier.
Thank you, Mr. Chair. Appreciate it. Just a couple of comments, and I may have a couple of questions, but a couple of comments. One, thank you for getting us to this point. Things are operational. People are getting the leave that they need to take care of themselves and their family when they need to. I want to say how refreshing this is, because at a time when we have both political parties in this country speaking about affordability, in the state of Minnesota, we're actually taking action that actually addresses affordability. When we talk about this shift in the way the system has worked and how it has been shaped around the employer and the demand for the labor, but not much compassion for the worker that drives those businesses and the profits that are made, we're shifting here. And when there's a shift like that, sometimes it feels like you're being wronged because you have always had the power. So there is a shift going on here. And again, back to at a time of affordability, now we have workers that have the ability to say, I can take time off and not be concerned about not paying my bills like I had been in the past. So thank you for implementing a program that is getting toward that question and answering and providing a tool around affordability that so often we give lip service to, but we don't actually do the thing that we need to do. And we are actually doing that here in the state of Minnesota. So I appreciate the work you all are doing. And I appreciate all of the comments from my colleagues on the other side in regards to the conversations that are being had in real time and what we can plan to do to try to make some tweaks to make it operate better. I think those are great questions, and we're policymakers. So I'm looking forward to seeing legislation so we can have that debate around what we can do. And I welcome that, and I appreciate that. That's the way it's supposed to work here. And I appreciate the response from the leaders here. And your responses have been very cordial and just saying you implement the law as it is written. And those are policy debates, and I appreciate that. And we will have those policy debates. One question I do have, we've had some federal agents in the state recently. We've seen video. We've seen video. We've seen statements and interviews. But we've seen how there's been chemical munitions used on some folks that have been out exercising their First Amendment rights, and we know that those cause harm and damage. So my question to you, and I know you may not have the answer to this right now, and it may be a lag in it, but have you seen any of that in terms of applications that are coming out? Those types of actions being the reason for folks needing to access this program.
Commissioner.
Thank you, Mr. Chair, and thank you for the question, Representative Frazier. And I'll maybe ask Director Norfleet just to provide a couple brief details. But the short answer to your question is yes. As would any circumstance that causes injury or harm to the public. I think we have seen applications that have been tied to some of the violence that we saw in the as a result of Operation Metro Surge. I think we, as you would expect, if people have suffered serious injury, it's not unexpected. It's certainly, it's sad. But that is, I think, one benefit of having this program is that people who have been seriously injured now have the ability to take time to care. And I don't know if there's any additional details you might provide.
Thank you, Chair. It's relatively hard to quantify, but we do have evidence from calls to our contact center through references on serious healthcare condition forms that specifically reference Operation Metro Surge as a contributing factor to the need for a leave, as well as questions from the community, including individual applicants, healthcare providers, and insurers, all of whom have asked about how the program interacts with conditions that come out of the impacts of Operation Metro Surge. So we do know that this has had an impact on the claims that have come in, but it is relatively hard to quantify.
Any follow-up, Representative Frazier?
Yes, thank you, Mr. Chair. Thank you for sharing that. I guess it's kind of early on information, but I had suspected that there may be some impacts there, and that may require people to access our program. And I'll just say again, with this situation happening in Minnesota, I believe Minnesota is prepared in a way to ensure that some of our residents have the ability to have a safety net to be able to take care of themselves, where the harm may not be as impactful as it's going to be with some other states that don't have a paid family medical leave program in place. So again, thank you for the work that you've done, and thank you for helping Minnesotans have more affordable lives.
Thank you. Representative Wayne Johnson.
Thank you, Mr. Chair. Thank you for the presentation. I have some, as I guess, a small business owner in the service industry, I just have some questions regarding the requirement of having the job is guaranteed to go back to. In other words, when you take on leave. Does that also apply if the job is eliminated while they are on leave? In other words, they decide that, and this is what I'm hearing, it's just because, okay, we need that position. What happens is once you realize you have some challenges, you start exploring other options. And we're seeing more and more that office positions, especially in the service industry, can just be replaced by AI. I hear that every day. I talk to service, you call it everywhere, it's AI, or they move the call center out of state, and they just out of state. So my question is, if somebody goes on leave and the business decides we have to fill this, and we now found out that AI can do it so much cheaper, better, and going forward, and they just say we're just eliminating that position and it's going to be now AI. How is that handled?
Either one. Director.
Thank you, Representative. So the job protection provisions are overseen by the Department of Labor and Industry, including the reinstatement provisions.
I can't hear you.
Sorry, I gotta eat the mic here. So the job protection provisions are overseen by the Department of Labor and Industry, including the job reinstatement provision, the employment reinstatement provisions. What I can say is that with our statute, there is a provision that if the position was not going to exist when the employee came back, the job protection provisions do not apply.
Okay.
Representative Wayne Johnson.
Thank you, Mr. Chair. And so basically what could be happening and why people are feeling safe leaving out on leave and, they're able to take the leave, there is really no guarantee that they will have a position open when they get back if they just decide to replace it by AI or send it out of state with a call center. Because we're finding out, just the report today, I don't know if it's employees, that 70% of the companies have put in AI in some portion, and the reports are coming out that a very high percentage of white-collar jobs are going to be replaced. And implementing AI myself recently, because of challenges, I realized how easy it is and how advanced it is. And so I'm just wondering, concerned that there is going to be an issue where companies realizing the challenges, and if it isn't something you actually have to do with your hands or a special, really technical doctor or whatever, that it's just going to find out that AI can do it. And people are going to find out that the job just does not exist when they come back. I have just a couple more questions.
Go ahead.
Sorry,
Yep,
Mr. Chair.
Representative, go ahead.
Mr. Chair, question is, when you are receiving documents from doctor's notes saying that this person has had a baby or they need for health reasons, stuff like that, how are you following up with that to the doctors and the medical clinics to actually find out, is this really true, when you take into consideration HIPAA laws and they cannot reveal that information?
Deputy or Director, go ahead.
Thank you, Chair, and thank you, Representative Johnson. So I maybe want to start with one of the cool things that we're doing right now is a pilot with Fairview Health, where we're working directly with doctors to be able to complete the forms within their electronic health records to be able to share that information directly with the division. We're working with them through a consent-driven process that would allow us to be able to access that information, which creates a contained loop between being in the doctor's office and that certification coming to the division. Not all offices have that, so we do have a robust process for reviewing a healthcare certification form, including reviewing the credentials of the healthcare provider. And if anything looks off, we do call. We call back to the healthcare provider in order to validate that the form was actually filled out by that healthcare provider.
Representative Johnson.
Thank you. Follow-up on that is, are you doing that on every application, or are you just spot checking it? And the thing is, I've questioned because, again, going back to AI, it's amazing how the fakes can be made and how things can be made and presented forward. How are you, and is there something in there? Because you can't, I don't believe with HIPAA that you can just call into a clinic and say, did this person see you? Did this person see you? Did you see this person for this reason? Did you also say that they needed to do this? That's pretty in-care personal information. So I'm just wondering, how would you be able to do that just with HIPAA laws? And I know they're pretty strict.
Director.
Yep, thank you, Chair. Thank you, Rep. Johnson. So we do verify credentials on all claims. We do review each and every application that comes through, as well as having that overlapping series of controls that are looking at information outside of the certification form as well. We do also take in tips from the general public in order to tell us if something looks wrong. There's a variety of ways for us to find that. When we do have questions about a certification form, while we're not asking about like the specifics of the diagnosis or any of the healthcare information, we're generally asking whether or not the form had been filled out. We're asking about we're verifying that the form that we've received was created by that doctor, not the underlying conditions.
Representative Johnson.
Sorry if I'm being a little skeptical, just because, and again, going back to AI, everything is, I doubt a lot of things I see, whether it's on the news, whether it's online, in many different forms, is these forms, I mean, because we've also seen, fake prescriptions have been used. There's so many different ways, but without actually exploring and looking at every document and actually getting all the way to the doctor, which I know is not easy, and getting that information, how do you rely that that form wasn't, yes, it looks like it came from that doctor, it looks like it came from that hospital or clinic, but how do you prove that it's actually happened? And that's the concern I have without being able to actually get access to their visit.
Yeah, Commissioner, and then we'll move on to the next question if you have another question, yeah.
Thank you, Mr. Chair. I guess a couple points I might just offer. So AI is certainly a new capability set, but it is not. But I would say that it is not the only tool one could potentially use in attempting to obtain benefits that are not properly authorized for an individual, right? So it is a vector, but it is not a uniquely new thing inherently in terms of us having to validate the certification information. So that's, I think, Director Norfleet was speaking to, again, the thorough review that the team takes for each certification document that we have. But that's also why the other elements of program integrity are so important, as we've talked about a few times, right? That's why it's important for us to hear from employers, right? And that's why an employer has a role in every application in the paid leave program, because oftentimes, again, employers have a close relationship with their employees. They frequently tell us things that are useful and are actionable and allow us to ask follow-up questions so that we can target enforcement efforts exactly where they are best suited. That's why we compare the data that we get in from the applicant and a certifying professional and the employer on that piece. So it's got to be an all of the above strategy to get there, and that's what we're doing. And I think some of the program innovations that I think Minnesota is truly going to be leading the country on in terms of direct integration with some of the hospital systems is going to move the needle even farther, right? I think we already are, undertaking best practices and leading best practices around the country, and I think we're going to get even better in the days ahead. So I think I appreciate the question because, we have to be thoughtful about sophisticated actors out there. And I think that, the program integrity team that we've built, they're, people with a very particular set of skills, skills gained over a long career. And hopefully these are things that, and we're confident that those are going to be successful in terms of the objectives that we have.
Follow-up, Representative Johnson?
Thank you, Chair.
Okay, we have two more on the list. We'll get to that. We got about 15 minutes left. I have one quick question in between about private plans and how does the private plan, we've got about 18% of the workers you're saying earlier on a optional plan that's not part of the state plan. And how do we know from just a broad base of how many workers are out on paid family medical leave at a given time? Are you communicating with a sort of a conduit of what does it look like outside of your program, your insurance program, with other insurance programs? Because as policymakers, we want to know what is the impact on workers either out of work or are back on the job, and are we more short workers? I've heard stories that we have a clinic in Mankato that's 10% vacancy. 140 people are out on paid family right now. I've got a central Minnesota one that has 1,100 out on paid family right now. They're trying to just keep things moving, but that is currently, now I don't know if it's part of the state program or if it's private. I don't know that. How do you communicate with, and how do we then understand the greater picture of what we have here with this new insurance program? How do we see that private side of things, Commissioner?
So thank you, Mr. Chair. So under the law, the equivalent plan providers are required to provide information to us on an annual basis as part of our development of the annual program report that we will submit to the legislature. There is not anything in the law that compels equivalent plans to provide additional information on a more frequent cadence than that. With that being, with that being said, I would say that we've had constructive, relationships with the financial, with MIFC and those providers. And as I mentioned earlier in our testimony, we've worked closely with the Department of Commerce to, provide, to develop a very robust marketplace for private plans. But I think our statutory tools are essentially the annual report that we have. Obviously, it's a policy question for this, for policymakers, if they wanted to create additional requirements for private insurers. That's certainly something that could be discussed.
Okay, thank you. Representative Schultz.
Thank you, Mr. Chair. And I'm going to start with a quick comment before my questions. But I appreciate that the other side of the aisle has been eagerly listening to the conversation and discussion that our side has brought forward. So thank you, Representative Frazier, especially as the gentleman who led the changes to it in last year's session. And I also want to draw a little bit of a contrast and share that there are two sides of every story, and understand that while there were people who didn't go to work but were still being paid, some by state programs designed in this committee, who then may or may not have been tear gassed. And those people are potentially, according to the deputy commissioner and the director, are going to be taking paid family medical leave. The same, there's that circumstance. While at the same time, our federal law enforcement officers had fingers bit off, frozen water bottles thrown at them, in times causing things like concussions and severe injuries. They were spit on, and we had federal law enforcement officers who've been doxxed at their homes, and those same people are without this benefit. Those people who are enforcing federal law. That is two sides to every story. So the person who is paid to protest has paid family medical leave if they were tear gassed, and the federal law enforcement officer does not. That same person who had their finger bit off doesn't have that. And just to share with you how this policy was sold to our committee and to the public, that somehow this program was going to be a benefit to small employers, Mr. Chair, the information that has been provided to this point doesn't bear that out. The data provided right on this presentation shares that 67% of the people who are on leave are from employers of 200 or more. And the small employers, and Mr. Chair, and for the committee, half of Minnesota's workforce, 50%, works for small employers, 30 or less employees. And based upon the data provided to us this morning, only 13% work for small employers. And when I consider the people who I represent and the employers across the state, including in the city of Minneapolis, the burden for these additional costs, both for the employer and for the employee, share a different story. Because it's the constituent in my district who likes to work overtime, who is just like, I want more money in my pocket. I don't want to be told that I have to have time off in order to get this benefit that has been taxed from my bank account. And so I wanted to ask to the agency, from your perspective, why haven't more small employers and individuals who work for small employers been using this program to this point?
Mr. Chair, Representative Schultz, I guess I'd need to check the math, but I am reasonably sure that the 50% number you cited might not be right on target. But I mean, I'm happy to have that conversation. It's certainly not the case by wages. I would say that again, there to some extent. One of the trends that we've seen from at the beginning of the program is that employers with large FMLA, large employers in some cases, leverage the program and I think encourage their employees to apply for the program in part because they already were on FMLA or other elements there. To some extent, there's an element of education, and we're continuing to do that around the state. And that's going to be an ongoing process, and we really look forward to that continuing. But I would say we've had very strong, I'd say that we've had very strong engagement from small businesses. I think actually when we announced the launch of the program, we did that at a local business up in Northeast Minneapolis, where the proprietor is able to really make this work for her employees. So I would just say I'd be eager to engage maybe after the session on the numbers, but overall, this is a program that puts small employers on a level playing field with large employers in terms of being able to have access to the same types of benefits that large employers have been able to have.
Any follow-up? Okay, thank you. Representative Mecklin.
Thank you, Mr. Chair. This is kind of something that I've been pondering on for a few months now. End of last year, we had open enrollment for our standard benefits. In that conversation with the nonpartisan House HR, I asked the question, going forward when January 1st, when this comes forward, will we be having 0.88 or whatever portions thereof coming from our legislative income? And the answer was yes, but then they chuckled saying, because you're not eligible for the benefit. Is there a reason that DEED is collecting 0.88 on behalf of all the legislative salaries when the legislators themselves are not eligible for a benefit? I'm curious.
Commissioner?
Mr. Chair and Representative, I think there is not a specific, again, in the coverage provisions of the paid leave law, there is not a specific exclusion for legislators. Right? It's not called out as a particular group that is not covered under the law. In terms of eligibility, right? I think my sense is that's more of an issue just with other benefits and kind of the nature of legislative employment. as opposed to a specific ineligibility provision within the paid leave law. So overall, though, I think the short answer to your question is there is not a specific note in the law that says that legislators are not part of the covered population.
And it could be legislators or any elected official that has an election certificate. So any follow-up?
Just interestingly enough, years prior, after wage theft law passed, I was informed back then that we are not even eligible for that because we are not classified as an employee. So I guess maybe it was something that should be looked into as to why we have 201 legislators, which is costing the taxpayer roughly $100,000 annually, paying for a benefit that we are quite frankly not even eligible for. Thank you.
Representative Frazier.
Thank you, Mr. Chair. I'm going to yield to Rep. Greenman, who was not in the room and had a chance to this thing.
Representative Greenman.
Thank you, Mr. Chair, and thank you. I am really glad to hear that Representative Schultz, Representative Meckland, it sounds like you're making a case to expand the benefit. And I think that we want to cover and ensure that as many Minnesotans have this as possible. So happy to, and I think Rep. Frazier would be happy to spend his last term in the legislature working with you to expand that benefit. I also wanted to respond, Representative Schultz. Last week, you told us that this federal occupation, the lawless actions on our streets, is good for Minnesota's budget, despite the evidence we heard, despite the actual facts. This week, you're slandering Minnesotans, hundreds of thousands of them, as paid protesters, these Minnesotans who have been standing up for the constitutional rights of themselves and their neighbors, who have been caring for their communities, who have been protecting the folks, the Black and brown folks who have been indiscriminately pulled over, and two of those Minnesotans, Renee Good and Alex Preddy, who were killed for it. So before you speak about what's happening in our communities, not just in Minneapolis, I think following the Minnesotans who are believing their eyes and actually are seeing what is happening on our streets, are seeing what's happening in their communities, in their small businesses, I'd advise you to believe your eyes too. Thank you.
Thank you, Mr. Chair. DEED team, thank you for your work in delivering this really important program for Minnesotans. I'm delighted to hear the implementation is going so well and coming in under budget and early, et cetera. One thing that jumped out at me especially, and it was prompted by a comment from one of my colleagues about being open to changes, and is it, boy, you had this program that, it launched perfectly, how could there not be any changes? What I heard you say is that actually you're constantly making changes in response to feedback. You haven't yet identified any legislatively needed changes. If you do, please let us know, and it won't surprise you that we, folks may be coming up with ideas. That's what the legislature does. But what I heard you say is that you're making changes all the way along, which is terrific. It jumped out at me that the average leave time is nowhere near the maximum amount of leave time. We expected that Minnesotans were going to use this when they need it, and that's what people are doing. It was notable to me, a point was made that a relatively small percentage of the folks seeking leave work for small employers, a much smaller percentage than the number of Minnesotans working for small employers. We heard so much about the burden of this on small business, and then it turns out that actually, generally speaking, it's more employees of larger businesses taking advantage of it. I don't know what reason there may be for that. I can imagine various reasons, but the fact is, it's in terms of it being disproportionately impacting small businesses is actually the opposite. We believe on our DFL side, I would hope that my GOP colleagues would agree, that every worker should have time to be with their new baby, time to take care of their needs when they get sick or when a family member, someone that they love, to care for them. That is a critical need. And I would say, boy, if you identify any workers out there who do not have that benefit, we want to make sure that they have that benefit. Paid leave should be nationwide, right? This is something every other developed country in the world has this. Thank goodness that our state has joined the other 12 states that have this. And may we in fact pave the way for this to be something that people in every state can receive. So thank you so much, Mr. Chair, for having this hearing. I think it's been so important to receive these insights for how well this is going. And boy, let's keep it up and let's be proud of something that our state has done to fulfill this important value of people with time with their families. Thank you, and thank you, Mr. Chair.
Thank you very much again. I appreciate the conversation. We've got one more follow-up question with Representative Bakeberg. I think, again, this is just an overview of out of the gate, early on. Some numbers are hard to see because we don't have a lot of trending yet. But what we are seeing, though, and we want to make sure we bring it here, is that there's other agencies involved, too, like the Department of Labor. So to those things, there's some things that Representative Mecklen brought up about how do we get through those apprentices. We don't want people laid off because somebody is going on leave. We want to make sure that we have those things figured out. Something was brought up about elected officials in Minnesota. Again, we aren't eligible, like we are not eligible for unemployment insurance, and our employer, the state, doesn't pay for those on our behalf. We should look at those kinds of things that make sense. There's S-corps that just have a single employer or two. The employer or the owner of the company gets a W-2 paycheck. They will never take paid family. So for those really specific kind of things, we should look at how can we better the system without talking about major changes, but we want to make it flow better so those little tiny operators are not paying a new tax when they'll never use the program. That, to me, I think is a really important part of what this discussion has to be this year, now that it's out. Again, I said early on, congratulations. It rolled out the first step. Now it's what next? How will we keep Minnesota competitive? You know, my friend and co-chair wants to have it nationwide. I get it. Not all states may do this or see this anytime soon, but then we want to make sure that Minnesota stays competitive with not only good workers, good employers, but we want to attract more people here. And I hope that this kind of thing adds to it. It's too early to tell. But I'm nervous about this in the long run. So we'll continue to talk about this. To that, we'll go to Rep. Bakeberg and then follow comments with Co-Chair Pinto for tomorrow's preview. Representative Bakeberg.
Thank you, Mr. Chair. Thank you, Mr. Rowe and Mr. Norfleet. A couple times you've referenced an annual report. And I think just being very honest, one of the things that is kind of frustrating for me as a legislator trying to balance my other job as well is we get these reports and the nature of the environment and just the people wanting to meet and our schedules doesn't really allow us to be able to really dig in and understand these complex topics. But more importantly, it doesn't allow the public to understand all of these complex topics. So in the nature of some bipartisanship, I've really appreciated the work that Representative Keeler and I have done around attendance and truancy. Just last week, we had a meeting with the department, and for multiple years, we have been asking for a public-facing dashboard so that we can see real-time attendance data. And it's not released yet. They're going out for the RFPs, but what the department has done with the money that was allocated in previous sessions is to put together a real-time dashboard that will allow us to be able to make informed decisions in a real-time manner. Has there been any thoughts or discussion to do that around paid family medical leave?
Very quickly, we got to wrap it up. Go ahead, Commissioner.
Mr. Chair, Representative, I think we'd certainly welcome the conversation, right? We have, hopefully as today's hearing demonstrates, we are committed to transparency in this program and would welcome conversations in that regard.
To be continued. Thank you very much, Representative Baker. We're going to have to close it up because of our time as our rent has ended. Chair Pinto.
So then, Mr. Chair, I'll be very fast. So 2 presentations to us tomorrow and 2 bills, both to be laid over. One of those bills from Representative Hussein. Thank you, Mr. Chair.
Very good. Indeed, Commissioners and Deputy Director, thank you very much for coming in today. Thank you. We are adjourned.